Okay, well, firstly I'll introduce myself. I'm Lois Aspinall from BBC Media Action. For those of you who don't know who Media Action are, we are the BBC's international development charity, and our objective is to inform, connect and empower people around the world using media and communication. So, a little bit about us. We're BBC in name, but not in licence fee, unfortunately. We are entirely externally funded. And we use media and communication to work in health, which is my area, governance and accountability, and resilience and humanitarian relief. Marianne invited us along here to talk about health communication, and I must confess that we don't have a huge track record in neglected tropical diseases, but I thought we could probably come and share something about using health for communication for health in general. So, having said that, in scraping about in the archives and talking to colleagues, I did unearth a project that we did back in the 90s on leprosy, and tracked it down on YouTube, this public service announcement that we made, and I was hoping to be able to show it to you.
यमदूत पृथ्वी लोकबाट आज यहाँ को आएका छन् सबलाई उपस्थित गराओ
कान्तिपुरबाट आयु नसिदिकन आएको वडाध्यक्ष प्रभु यो
आफ्नो आयु नसिदिदै तिमी यहाँ कसरी आयौ
प्रो सुरुमा मलाई यहाँ जिउमा लाटो दागा अनि सबैजनाले चाहिँ तँलाई उ गरेर चाहिँ देवी देवताको श्राप लागेर कुष्ठरोग लाग्यो भने अनि सबैले हेपेपछि मलाई पृथ्वी लोकमा बस्नै मन लाग्यो प्रो अनि त्यसपछि आफैले उ गरेर डोरीले
कसले भन्यो तिमीलाई यो देवी देवताको श्राप बनेर हामी कसैलाई श्राप दिदैनौं हामी सबै प्राणीको हित चिताउँछौं यो कुष्ठरोग दुष्ट कीटाणुहरूको कार्य हो यसको लागि यो औषधि नियमित रूपमा सेवन गर्नु निको हुन्छ जाओ पृथ्वी लोकमा फर्केर जाओ
प्रो ओखती मूल त सबै यमलोकमै गरेर जानु पर्ला जस्तो छ नेपालमा त ओखती एकदम महँगो छ प्रो
पृथ्वी लोकको स्वास्थ्य केन्द्रहरूमा कुष्ठरोगको औषधि निशुल्क सेवन गर्न पाइन्छ त्यही बसेर खाओ
So, kind of batshit, I think you'll agree, but I actually think it's it's a PSA which holds its own. It uses quite a sort of a tightly constructed dramatic setting to debunk conventional wisdoms that leprosy is given by the gods, and so, you know, people feeling lack of empowerment and subtly getting in a kind of early warning signs message and key information about how to get treatment. So I actually really like that, and that's why I showed it to you, but you can see why I was a little bit nervous. So the majority of our work is around maternal and child health, sexual and reproductive health, infectious and communicable diseases, as well as factors that increase risks to health, so things around poor nutrition, hygiene, and increasingly a kind of gender element on health. And our approach in a nutshell is that we think that health is influenced by more than biomedical factors, and so that's where media and communication comes in. But we also think that behaviour change comes down to more than knowledge and attitudes. And we try to foster supportive social environments, so either by targeting social norms or gender norms that are barriers to health, or by using media to target key influencers. So I think we're on the next one, hopefully. So I'm going to just show you something that was a little bit more up to date. One of our projects in India, called Adaful. It has a very broad objective around gender, and the programme, which hopefully I'm going to be able to show you, uses 3 adolescent detectives. It's targeted at adolescents, this TV show, and a kind of whodunit style. And there's a health dimension to the programme, but the programme is generally about gender. But the health kind of stuff comes in with tackling sexual health issues, sex-selective abortion, gender-based violence, and other areas. So let's see if we can roll tape. Come on. So I think it's on the next slide.
बाबूजी को ना लाइफ में एक ही अफसोस कि मैं लड़की हूँ, लेकिन लड़कों से किसी भी मामले में कम नहीं हुई।
तारा कहो या टाग, दोनों नाम हमारे ही हैं। भाई का ये टागलेट ना हमारा बेस्ट फ्रेंड है।
वैसे मोहतरमा, मैं ये सोच रहा था कि
आप कौन है?
हमने कभी देखा नहीं यहाँ पे।
स्कूल ज्वाइन कर रही हूँ, पढ़ाती हूँ।
प्रिंस नाम है हमारा।
आप लोगों को ये ठीक लगता है इतनी कम उम्र में मेरी शादी?
आधा फुल का नया टेस्ट।
लेकिन इस बार केस इजी नहीं था।
दिल में है तूफान, झूमे जिस्मों का, लाख ढूंढो मगर मैं तो बहती हवा में रुकूंगा कहाँ? धड़कनों को पता, मंजिलों का पता, यादों में नाचे तूफान।
अब तो मानती है ना कि अपनी टीम है, कुछ आधा आधा नहीं है।
आधा क्यों? फुल है। आधा
आधा फुल देखिए 21 अक्टूबर से हर शुक्रवार से रविवार शाम 7:30 बजे सिर्फ डीडी नेशनल पर, देश का अपना चैनल।
Thank you. So that's At a Full, the kind of main event TV show, but it's also accompanied by radio discussion, which is very youth-led. Also, I believe there are mobile games in development and a graphic novel to accompany this. Finally, I'm going to talk to you about one of our projects in Zambia called Tikambie, which has a slightly older target audience and is a project that we're doing in partnership with Restless Development. It's about supporting the uptake of healthier sexual and reproductive health behaviours with a rights element. And predominantly it's radio, but also TV, Facebook, and Restless Development are leading on outreach work, which is peer-to-peer education activities. So the context around this project is that sex is both a taboo subject in discussion, but adolescents think it's very widespread and that having multiple sexual partners is the norm. But it's rarely discussed in the household, with parents feeling as though if they talk about it, then they're going to be encouraging sex, and they don't want to do that. So this project is about creating a space in which young people can talk frankly about sexual health.
Let's talk. Katula vile Paul. Naturande. Let's talk about you and me. Let's talk about all the good things. Talk about things that make me. Let's talk about you.
It's Tikambie Natulande, your number one sexual reproductive health show. As usual, we bring to you nothing but the educative best.
Tikambie looks at breaking those cultural barriers, getting young people to talk freely, getting young people to talk to other young people on sexual and reproductive health. It's about getting the conversation started and giving young people access to accurate information that will help them to make better and informed decisions.
I go out there to talk to other young people in the community to say, this is our right, this is our sexual and reproductive health rights, this is what we need to do as young people. When a young person hears from me as a young person, they will have more confidence to talk about it, to have a dialogue about it, meaning that person will say, okay, if a young person can talk to me, I think I can voice out as well. I can talk to this person, I can talk to my parents about this, and that, I can acquire more information about it.
251961 is the number you're calling us on.
Menstrual and pregnancy.
So you'd be thinking maybe I'm pregnant. Yes, that's what I thought.
This is a program that has created that platform for us young people to, join in the fight and freely express our views without being criticized.
Before Tikambie, there was that insecurity. Is she going through what I'm going through? Is she doing what I'm doing? And now it's like, okay, this is normal.
I've featured on Tikambie program twice, and some people would call in, others would text me on Facebook and say, you're very inspiring. We didn't know someone living with HIV can actually come out. It has really helped us understand a lot about HIV or sexual reproductive health. It's just created that platform where we youths can be ourselves.
Okay, so evaluation results are just coming through on Tikambie, and things are looking really good, really positive so far. My colleagues in Zambia and our research team over there tell me that reach is very good. The programmes, either the TV, radio or Facebook, or the outreach work is reaching half of the target age group in the areas it's working. And in terms of impact, I have a quote on the next slide, if that's possible. So we use quantitative and qualitative results to assess impact and indeed to inform the design of our projects. And this quote, I think, really nicely talks to some of the stories of change that we're getting around sexual rights. This idea is backed up also in our quantitative analysis. We're doing logistic regressions on N-line data to compare exposed groups versus unexposed groups on particular attitudes and their behaviours and some other practices. So the results from that suggest that audiences are 1.6 times more likely to agree that everyone has the right to demand partners use a condom. They're 2.5 times more likely, if they have watched or listened, to discuss STI prevention with a new partner. They're also twice as likely to feel supported by key people, and that included parents and older people. So ultimately, challenging power dynamics in relationships and encouraging discussion, fostering more supportive, enabling environments, was all part of our theory of change at the beginning of the project about how we might try to achieve behaviour change in this area. So it's great to see that ultimately audiences are twice as likely compared to non-audiences to have visited a sexual reproductive health clinic in the last year, and after controlling for relationship status, age, education and income. So really nice results coming out there. I did have another one.
យើងនឹងនាំយកអ្វីដែលថ្មីអស្ចារ្យដែលតកតទៅនឹងស្នេហារបស់មិត្តយុវវ័យនិងបញ្ហាសុខភាពបន្តពូជ
ខ្ញុំសារីតា
ខ្ញុំយ៉ារ៉ូ
ហើយយើងទាំងពីរនាក់នឹងធ្វើទស្សនិកជនសប្បាយរីករាយជាមួយនឹងកម្មវិធី Snap 9
A brand new TV series draws on the huge youth appeal of Lois 9, BBC Media Action's transmedia civic engagement project. For the first time, the TV show uses comedy to open up this taboo subject. Whether it's the comic relationships that form the heart of the drama series or the light-hearted discussions in the studio with celebrities and guests, Love 9 aims to make talking about sexual and reproductive health something normal and acceptable.
កាលនោះទៅមកពេញដំបងដែរបងអាយុប្រហែលជា16 15អីដែរអញ្ចឹងចេះឆ្ងល់ថាហ្នឹងស្ករកស៊ូមិនគេលក់នេះថាស្ករកស៊ូបែបហ្នឹងមិនគឺខ្ញុំអត់ដែរស្គាល់ពីមុនបានអ្នកលក់អីគាត់សោយស្រីគាត់អៀនណាគាត់ថាអាហ្នឹងស្រោមអនាម័យអញ្ចឹងបាទខ្ញុំថាអូ
Changing attitudes and behaviors is much more than merely providing information. The comedy drama opens up frank discussions between young people on the subject, but also allows different perspectives to be voiced.
ទៅពិនិត្យសុខភាពនៅឯមន្ទីរពេទ្យតោះចាំវិធីធ្វើតាមគេប្រាប់អូយអត់ទេដែរទៅកន្លែងហ្នឹងឯងមនុស្សមើលយើងដូចអីចឹងដូចមិនដែរឃើញយើងមកពីណាចូលអូយអត់ចូលទេហើយមិនចូលទេដល់ហើយបើលើនឹងអត់កើតមែនណាកាន់សិលហ្មងមកចូលមកអត់មានកើតអីទេពិនិត្យហើយច្បាស់ខ្ញុំអត់មានកើតអីទេមិនសិនខ្ញុំនឹងរួចទេ
So thank you very much. Happy to take any questions later. And thank you up there.